Well, hello and welcome. Thank you for watching. For those of you that don't know me, I'm Dr. Elisa Peavy. I am a family medicine physician, and recently I have been speaking out, have been very vocal about my concerns regarding this recent mandate regarding the to many employees at various hospitals, hospital systems, clinic systems, etc. My biggest concern, of course, is that we have documentation according to the reporting system that we know that is actually under documented, underreported. We don't have enough documentation. And in order to get something documented, it is not just a simple, I'm going to call them up and have them give me a check mark. The physician has to actually go to the system itself. They have to fill out paperwork. I mean, there's a lot of red tape, and not everything is reported. And what we know currently, as far as what I'm actually able to find data for, is that we have close to 12,000 people who have died from this injection. We have 500,000 people who've had their reactions reported. And I've been hearing, and actually I have not found a direct link or evidence of this yet. So if anyone has this information, please reach out and give it to me, because I don't want to report something that is inaccurate. But my understanding is actually the number is not 12,000 of people who passed away from this. It's closer to 50,000.
Right.
And I've heard this from a number of different places and a number of different sources. And that's shocking. That's shocking that with that many people, we are trying to push this mandate, knowing we're going to have injuries, disabilities, hospitalizations. We have a study that shows an 80% miscarriage rate in the first trimester. There are massive concerns, and yet we're trying to tell our employees that we're essential last year. Remember those employees that we were so grateful for, that we were saying thank you so much for being the ones to put yourselves out there on the front line, putting yourselves at risk. All of a sudden we're telling them now, because they're not willing to take a chance of dying, we're suddenly telling them that they are replaceable. Well, that's not okay. And it's not okay that people are being injured and that we're saying, oh, well, you know, we're saving lives, so it's okay for them to be injured. Well, no, it's not. Talk to the person who's been injured, and they will tell you that that is most certainly not what they wanted to experience. So today I have two people that I am very grateful to have here that are going to share their stories. We're going to start with Taylor. She is an ICU nurse, and then we'll finish with Shelly, and she has a personal injury story that she's going to talk to you about. So Taylor, go ahead, take the floor. Just, you know, kind of tell us what you saw on the floor, you know, the patients that you saw. If something was being shown in the media as far as, you know, something that you weren't seeing, you know, please talk about that. Anything like that you've seen and experienced over the last 18 months.
Thank you. Hello, everybody. My name's Taylor. I work for a local hospital, and I mostly worked on a medical surgical floor during the pandemic when it was bigger last year, and just recently went to the ICU this year. When I was on med surg, you know, we weren't the official unit for cohorting those patients. We didn't have a whole lot of those patients. But the ones we did have, you know, they ranged. Not all of them were super sick. My whole thing with COVID is, the whole thing is it just affects everybody so differently. You know, I've seen patients who were in their 40s die, and I've seen a 94-year-old woman be on room air and just be stuck at the hospital because she can't get into her nursing home again. And so, and I mean, she was there for like 2, 3 weeks, but she was fine, medically she was cleared. But during this time, a lot of the facilities weren't taking them back. And so they were just stuck at the hospital. And it was just really frustrating during this time because, we were doing testing for pre-surgery. So there was actually quite a few cases where the patients were there for, say, an appendectomy and just so happened to have CV. And so, of course, that's a case counted, but they had no symptoms of CV. And of course, that's going to happen. But it was just really difficult. And of course, I did see some of the worst cases of CV-19, but it still doesn't make me afraid. Like I still feel like I'll be okay. I had CV-19 over Thanksgiving. It was definitely weird for me. I was short of breath and whatnot, but I was fine. I recovered. I haven't had any side effects. I had some insomnia, after, but other than that, I've been fine. And knowing that, like, I feel like I'd be okay to get it again. I do not want the vaccine. And I feel like telling a 26-year-old female with no medical issues that she has to get this vaccine is just wrong. Like, I don't understand why I have to get it. Um, and obviously I can't see all the cases, but since being in the ICU, there's a couple things I've seen, with CV-19. I had a patient who was super healthy, was in her 90s, was always out gardening, was totally independent, got the jab, and within like a week or two, she came into the hospital with a stroke. And it's like, of course, everything we learn in school is, correlation doesn't mean causation. I totally get that. But it still should be triggering people to think about it. Like, okay, that's kind of interesting. I had another patient who came into the hospital, and he was only in his 40s, and he didn't have a whole lot of medical conditions. And he came in and just multi-system organ failure. And before he was intubated, told the physician that he had been had the jab. Like, I think he had his first or second one just like a couple days prior. It was within like 4 days, and he came in with multi-organ failure. And of course, the first thing the note says from the ED physician is, this is not related to the vaccine. And they didn't have um, his jab documentation. And then every note, keeps mentioning, oh, this isn't related. This isn't related. And of course, we couldn't find it. And then he was intubated. And so no one really knew. And it was like my sole mission to find this information. And so I eventually found his jab card and his belongings and took a photo of it and made sure it got into his medical record. And it was like fighting like tooth and nail to get the provider to at least put in a VAERS report for this, because who knows, of course we cannot prove it, but we should at least report it, because you never know. And so in the ICU, the whole attitude around like jab reactions is everybody denies it. They deny it. They deny it. They will not report anything. They just deny it. And I don't, there's a couple nurses that feel the same way I do, and we just don't understand why they just flat out deny it. It's like I bring along this analogy of like, okay, if this new weight loss medicine was introduced and everybody started taking this weight loss medicine, and then all of a sudden all these people start showing up to the ER with all these crazy symptoms, and they say, well, have you taken anything new recently? And then they say, oh yeah, I started this new weight loss medicine. They would totally blame it on the weight loss medicine. But right now we're not doing the same with the jab, and I don't understand what is happening. I've seen a couple family physicians in the past week, and tried to kind of get information from them on their thoughts. And one of the doctors I saw yesterday was like, oh, it's pretty safe, and, we're not really seeing any side effects from it. And I'm just like, what are you I wasn't gonna argue with him, but in my head, I'm just like, what are you talking about? Like, how can this be possible that you can say that? Like, are you just saying that like the people that are reporting side effects are lying? Like, how can you turn your eye to this? I don't fully understand. And so I don't know, the whole thing is just super frustrating to me. And at one point in time, um I thought to myself, like, I'm not going to lose my job over this. Like, if I have to get it, I have to get it, whatever. But then it became, the whole situation has just become so fishy to me. Like, the whole situation is just weird. The way the government is pushing this, like they've never pushed any other vaccine so hard in their life. And it's just weird to me. You know, of course, I am definitely not an anti-vaxxer. I've had all my other vaccines. I've been getting the flu shot for 26 years. Like, that's no big deal. But the whole situation is just fishy to me, and I feel like we're not getting the full picture. And unfortunately, I feel like we're not. And I don't know if we ever will get the full picture. And I don't know if this will ever end. And it's super frustrating to love what I do and love taking care of people. And it's super frustrating when, we do, like, I have posted just some things to the public to bring awareness of the Stop the Mandate campaign. And people will be like, well, if you don't want to get the jab, then you don't belong in healthcare. And it's like, how dare somebody say that to me? Or they'll be like, I wouldn't want you taking care of me anyway. Like, you must be a horrible nurse. And it's like, actually, I'm a really great nurse and I really care about people and I take really good care of people. And we still have to wear masks at the hospital. So what does it matter? Like, if masks are so effective, like, why does it matter if I get the job?
Yeah, you're exactly correct, Taylor. I mean, the problem is that from an immunity standpoint, regardless of, well, number one, we know that natural immunity is by far superior to anything else. So anyone who's had it is going to have natural immunity. And we also know that whether you've had the stick or whether you've gotten it yourself, in theory, what's supposed to happen is you're supposed to develop antibodies, against it in itself, and you shouldn't get that sick again or even have any symptoms at all. You might come in contact with the virus. We all do. You might carry the virus. You could potentially give it to someone else and you may not know because you're asymptomatic. That's really rare, super rare. Most of the time, if we're asymptomatic, that means our immune system is stepping in before it ever gets to the point where it's really bad. But all of us have the ability to pass it to someone else. And if we've had it before, or if we've gotten it, theoretically, again, we're supposed to be immune. We're supposed to have protection, right? So there are theories that we should still need to be behind a mask, and we should still need to have those who've gotten the injection to stay away from those of us who haven't, is such an asinine theory. And in fact, I've yet to have a colleague, an infectious disease doctor, have a conversation with me about how they think that works. No one says in mainstream media how that's supposed to work. They just make the statement and then people run with it. And we've yet to have
other viruses, like we think of like the chicken pox, if you had the chicken pox, then you didn't have to get that jab. And it's like, how is it that all of a sudden other viruses that we get antibodies for life, and all of a sudden this one special one we don't?
Yes.
It's so weird.
Well, and the thing is from following the people who have actually had this inoculation, they actually have shown, this is the kicker, actually. So the whole thing with this is they keep saying this is a new novel virus, right? Brand spanking new. Our bodies have never seen it before. That's why it causes so many problems for so many people, supposedly. It does cause problems for people, but so many people, it has yet to be determined. And gosh, I kind of lost what I was saying there for a moment. But so it's caused all these problems. But yet what we're finding following the people who've gotten the jab is that they are producing antibodies, long-term memory antibodies, after just a few days, 4 to 5 days, which means that they've actually already come in contact with these same proteins. Their body already has memory for it. We've shown that. They've shown that following the people who have received the jab. And so it's even frustrating that we have that evidence. And of course, they're not talking about it. They're not letting people know, about that. So all these things just keep being suppressed. And then of course we have therapies and therapeutics that doctors all over are using, over the counter and prescriptions. as well as things they've come up with. There's a doctor in Boise who uses immunotherapy. It's awesome. You know, there's so many different ones out there that are almost 100% if you get them within the first few days. So therefore, not only if we were to focus on and use those therapies, we hopefully would have less people who would actually die from the actual bug itself. And of course, then we'd save all these people who have had to pass away from the actual jab itself. I mean, why are we not looking there? You know, that's what my whole issue is why are we refusing to look there? And why is all that information being censored and suppressed? And then they're mandating something that we know causes problems. Like, come on here. It's just
like, don't get me wrong. I have seen people die from CV-19 that totally shouldn't have. Don't get me wrong. I totally have seen that, but I've also seen the other spectrum of it. And honestly, the young people that are dying from this, most of the time, it's because they waited so long to get help. You know, they haven't peed in 2 to 3 days. And so they're already in renal failure. Like, of course, they're going to be in the ICU and sick as hell. So I think a lot of that is that. I will say I see a majority of the younger people in their 30s to 50s, like that are in the ICU, if you're obese, and not just severely obese, but even just like 200s obese. I'm seeing a lot of those people in the ICU on
the comorbidities.
Which is interesting. Like, it could just be obesity.
But again, if we were able to get to those people before they got to that point, and if we'd been allowed to talk about it, if we'd actually been able as colleagues to have the conversation in an open manner instead of having it suppressed, we would have potentially saved even a lot of those people. You know, it was just very poorly managed all around. And, you know, you talk about people saying that doctors don't believe, which I've heard so many times, and I know it happens. I heard that when I was in clinical practice, that doctors didn't believe. I mean, I have injuries from other, you know, from other things women went a lot of women, teenage girls have gone through, et cetera. It's been really awful. But I was just directed to a website about a whole bunch of people that are listing their stories, and it's just story. I don't want to show. Well, I mean, they're putting it on there. There's story after story. People in the hospitals, like, these are my stories of injury, and not all of them have been heard. There are so many stories of injury. It is insane. And actually, speaking about injury, we have Shelly here. Shelly, thank you so much for joining us.
My pleasure.
Can you please share your story with us and tell us how everything went for you?
I went on April 1st and got the, sorry, I'm short, it's hard to see me here. And it was about 3 days later, I started getting a really, really bad headache. I mean, excruciating. And I lost my vision in my right eye. And I couldn't figure out what was going on. So I went to my doctor. I got sent to the hospital. I was told I had a migraine. It wasn't from, I knew it was from that. So I insisted I was perfectly healthy, just fine. I don't get headaches. This is very weird. Nope, you have a migraine, go home. It's not what you think it is. So I did. Well, I continued to get sicker and sicker. My left eye is now starting to act up, and I'm going to be going and getting a spinal tap next week because I have pressure on my brain apparently from all this. I had a blood clot and a stroke. Come to find out, I ended up probably 2 weeks after that, I ended up in a Chicago hospital for 7 days in a neurological unit. I was on high doses of steroids. They didn't know how to treat me. They didn't know what to do because they didn't know what was in my system. But they did say they all believed it was from this jab, but they're too afraid to do anything other than say that. And it is in my paperwork.
They didn't report it to the system?
Not that I know of. No, I did. My paperwork also
the open reporting system. That's where you reported it to. Yeah, but not the other closed.
They all, I know, two of them firmly were 100% positive, but I don't think they want to go through all the paperwork. But in my medical records, it does say I had that, and this is what they believe is a result of it. it also attacked my whole immune system. All my joints swelled up. I was in excruciating pain for the whole time I was in the hospital. They tried everything. I did probably 200 different blood tests, MRIs, CT scans, everything. They couldn't figure out anything. I was on steroids. I'm still struggling with 3 possible different blood diseases that they don't know if it's from the jab that's causing my numbers to act up or if it's actually something. But prior to my jab, I had been tested for autoimmune things just because I am a diabetic. And I was fine across the board, nothing. 3 months later, I'm a mess. I can't see, I can't drive. I have memory loss. I have no depth perception in my left eye. I'm blind in my right eye. I'm chronic pain. I can't work anymore. I'm to sit on the computer and chat and have a discussion I can, but I can't sit and read or anything anymore. It's completely ruined my life at this point. I take so much medication. I have 2 doctor's appointments a week, and this has been going on since April. So it's
Oh,
definitely
Shelley, I'm so sorry.
yeah, very concerning.
Yeah, absolutely. And talk to me about your medical bills and, you know, who's
Oh,
paying for those?
well, luckily my husband has insurance, but they don't pay for everything. So I have a lot of medical bills still sitting here I have to pay for. I don't work anymore because I can't go to work. I can't drive. I can't see out my right eye. And I have such bad pain. My feet swell up the size of watermelons, I swear. And the pain is excruciating. I have nerve damage from my feet all the way up to my knees. All my nerves are just like on
And what do
fire.
they tell you now about future
They,
inoculations?
I'm not to get the boosters if those come out, not to do that. But other than that, not really anything other than we don't know how long this is going to be in your system and how long this is going to be affecting you. I will never get
You kind of broke up on us.
damaged completely. Oh, I'm sorry. Still, oh, yeah, it damaged my optic nerve, so I'll never get my eyesight back in my right eye. I have partial loss in my left now. So it's kind of gradually getting worse. So they're going to try to save my left eye. But they don't know how long this will be in my system wreaking havoc. I can't, my inflammatory markers are so high, they're flabbergasted at my numbers.
That's the problem with this, is that because we don't have those long-term studies, and
Right.
because of the studies that were done on animals on it was a different thing, but it was very similar. It used the same proteins, the same spike proteins. Those animals long-term didn't do well, and it was inflammation, and it was from that everything else started happening, because really the immune system is continually trying to battle those proteins, and they just it gets worn down over time.
Yeah, they said the immune system is very hypersensitive and overactive at this point. And they've been trying to treat the symptoms, but they can't treat the underlying because they don't know what's in my system.
Yes. So yes. So Shelley, I'm going to tell you that I don't know if this will help you or not, but, and I don't know where you're at. But there are doctors, this doctor I was speaking about, the immunotherapy, he had a patient who had just gotten the EE. She was an elderly lady in her 90s, clear as a bell, completely, you know, everything awesome. And I mean, no signs of any memory, anything, right? She's one of those little spry ladies that like all of us wish we can be when we get older.
Right.
And all of a sudden, after she got that, within a couple of days, I mean, it seemed like almost complete dementia. And so she was brought to him, and he started using these proteins, immunotherapy proteins, and within a week, all of her symptoms were gone. So I can send you at least his information, and maybe he can direct you to someone close to where you're at or something, but that might help at least get your immune system as strong as possible, so that you can, yes. And I'm so sorry what you've gone through.
it's just really sad that they don't believe or they try to mask the fact that people like myself are suffering. And it's affected my life tremendously, all the way from my income to being able to take care of myself, drive myself to the grocery store. I can't do what I would normally do. And it's very hard mentally as well to deal with that. And I felt like I was pressured into it because I wanted to go to Germany. My daughter is in the army, couldn't go into Europe without a vaccine card. I wasn't going to get, whoops, I said the word. I wasn't going to get the jab, but then in order to go see my daughter, I had to, which really upset me too. So I bit the bullet and now I can't fly for fear of another blood clot. So either way, I lost.
Yeah. Oh
So
my goodness.
yeah, it's been rough.
Yeah. Well, I highly encourage you to see if your doctors can get it reported, because they do have compensation. It would be, it wouldn't just be an easy thing. I mean, you would want to have a lawyer and stuff like that,
Right.
but you have a really good case. And I mean, especially for the money that you're that's coming out of your own pocket for this,
Oh yeah,
that's not right. And it's not fair.
no,
And so,
I had a great job. I had a really good career and was very active. And I sit at home now because my anxiety is so bad that I'm gonna lose my sight, in my left eye at any moment. It's very mentally challenging
yeah,
taking a
yeah,
test.
I can tell. Well, I think you're amazing. And I definitely, I also believe there are things that we can do that can get you feeling better. And I don't know to what degree, but I do think we can get you feeling a little bit better at least. So,
That would be great.
but thank you so much for sharing your
Oh, my
story.
pleasure. I really respect what you're doing. I think it's amazing.
Thank you. Thank you. And
I just
Taylor,
have a
thank
couple
you.
more things.
Yes, yes, please.
So I just, part of it too, I do want to caution, society and believing everything that the media says about, oh, the hospitals are full, blah, 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 because even there was at one point in the very beginning of this, I think last like March-ish, basically March through June, the unit I was on was a 24-bed unit. And we consistently had like 0 to like 5 or 6 patients for a majority of that. But the news outlets, of course, were saying hospitals are full. And I'm like, what are you talking about? And don't get me wrong, hospitals ebb and flow. We go up and down all the time. That's natural. Yes, there's been times where we've been bed for months. Recently here in the Treasure Valley, we're noticing the ICUs and all of our floors are super full right now, but it's not CV-19. Yes, we are seeing a slight rise in cases, slight. But a lot of it is because we have a bunch of people moving here, a bunch of retired people moving here to the Treasure Valley, and we haven't had a new hospital go up in a very long time. And so all of our beds in the ICU and all of our other floors have been full of just sick people, just, normal things that people normally get sick with: strokes, heart attacks, liver failure from drinking. I mean, just all these random things. And the problem is we have all these people moving here, but no new hospital beds. And so our hospitals are full of all this stuff. But of course, the media isn't reporting that, and it's frustrating because people don't think about little things. So recently, an employer came out and said, oh, well, we've had 20% more of our employees out sick with COVID. Of course, what does that mean though? Does that mean that in May you had 10 employees out and this month you have 12 in a, somewhat 1,000 company? Like that's 20%. So to sit here and just like listen to the media, don't listen to it because it's not true. And like I just went on, the dashboard for a recent or a local organization, and only like 10% of the hospital cases right now are CV-19. And just like I was talking to my mom yesterday, it's totally expected for us to have these little surges every time we remove mandates or start to open things back up, because that's what happens. If every time cases go up by a couple percent and people freak out and throw on all this masking again, then of course cases are going to go down. And then when they go to lift it, it's going to go back up and then they're going to freak out. And so it's super frustrating to sit back and watch the media spin this like, oh my gosh, cases are up. It's like, okay, just barely, but because we took away masking and people are traveling, and we have to at some point, I feel like, just let this ride out and see what happens.
Well,
You just
and
gotta
also
let it
it was,
ride.
yeah, well, and also it was mentioned, you know, one of the other health employees, she said that, and she's a transporter, she said that the testing for this had gone down, and probably about a month ago, when suddenly we're looking for another variant, they started testing everybody. She said that they were testing, you know, a basic like abdominal pain, like that they didn't even have any symptoms that would be suggestive of this illness. But they were testing everybody anyway. So when we start testing the asymptomatic people, we're going to start coming up with more cases. It's just going to happen, because again, that test itself, if you can take just a tiny fragment of this illness, which we've never isolated it, and it's in total isolation. So we don't even have the illness itself. We've never isolated the actual bug itself. We only have fragments of it. So what they do is they take this tiny little fragment and they estimate what that bug is supposed to look like. So they're estimating what this new one is supposed to look like that they're trying to scare everybody with. And they also have estimated it for what the other one was. You can, with any estimation or with any tiny fragment, how many estimations can you get from that, or how many potential outcomes? You can get a crap ton, and you can always find exactly what you're looking for also. So the fact that they're going back to testing any and everybody just is very telling in terms of what they want the numbers to show, I think. I mean, that's what I'm seeing, and that's what it looks like. It's very frustrating, you know.
So, Shelly, what you said about you wanted to travel. So I had one of my friends, her parents are retired, and, you know, after being locked up for a year, they wanted to get out and travel. Well, the cruise ships are actually segregating the people who have had the jab and the people who haven't. And if you didn't get the jab, then you don't get to participate in some of those activities, obviously, because you're basically you're quarantined from a certain section of the ship. And so they got it because they're like tired of this, and they're like, well, basically they're like, well, we're already old and retired, so if this kills us, then, you know, what's worse, sitting at home dying of, you know, anxiety, depression because you can't do anything, or, you know, risk it. And but of course, you know, she's like, I feel dirty. She's like, I let them basically coerce me into getting this jab, because if I don't, then I'm going to be segregated. And it's just like, I don't understand how society can look at that picture and think that that's okay. Like, this should be raising red flags that we are segregating society between if you've had the jab and if you haven't. And one of the issues that some of my coworkers are facing right now is the company, not necessarily on purpose, has forced it to be the jab versus the unjabbed. You know, like coworkers are like, well, you didn't get the jab. Why didn't you get the jab? And da 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 da. And then they, you know, everybody's talking about it and, you know, looking down upon you for not getting it. And, you know, they're noticing like doctors and nurses and even other people saying, oh, well, they're here for CV-19. I guess they deserve it though, because they didn't get the jab. And it's like, excuse you, like that is so disrespectful on so many levels. Like we didn't, you know, it's hard because I wasn't in the ICU when there used to be, you know, a flu season. And it's like, did you say that about people during flu season? It's just this whole thing is just so crazy. And the fact that it's creating so much hatred and divide. And the fact that people aren't seeing that is so frustrating. This is a personal choice if you want to get the jab or not. You know, at one point I was in some of those vaccine clinics for money to pick up shifts. And, you know, I told people, some people would come in like crying to me, like, I don't know if I should do it. I'm like, it's a personal choice. You know, it's totally up to you. Of course, there are risks. It all comes down to what risk do you want to take? Do you want to risk getting CV-19? We don't know the long-term effects of that either. We don't know if that will kill you. Or do you want to get this jab and we don't know the long-term effects of that and it may kill you too? So it really comes down to which risk are you willing to take? And
Okay.
personally, I should have the right to say, I'm going to risk getting CV-19 again, but they're not letting
Right.
us make that choice.
And then taking the medicines that help it.
Yeah.
Right.
Doesn't
Yeah.
make-
Yeah, absolutely. I completely agree 100%. And honestly, it feels like we're going back to Nazi Germany.
Yes.
And where are your papers? Where is your, I mean, that's what it feels like. And it's done in a coercive, full of shame kind of way.
Mhm.
I've had a couple, and now I'm tired of doctors shaming people into getting this. I'm over it, and it's so unethical, and it's just such BS. But I've seen a couple of doctors, talk about, oh, my baby was, just born and has antibodies, yay, because I received this, blah blah blah. Go get it, pregnant women, go get it. And I'm like, how in the heck can you even recommend this to pregnant women at all when we know that that is the highest risk of problems, especially in the first trimester? We have this study now that's showing problems, and yet we're still shaming people into getting it. I mean, the CDC has reported over 1,000 miscarriages alone. So it's just absolutely asinine that we think that it's okay to bully someone into taking a risk to actually get it versus taking the risk of catching it, and again, we have therapies that can almost treat at 100%. It's just, there's an underlying agenda is what it feels like to me, 100%. And which is
100%.
then even scarier when you say that, because then what is that? If we're knowingly sending people to be injured, what is that, So there's just, yeah, it's not okay. It's not okay.
No.
So again, thank you so much for sharing your stories, both of you. And I know this will have an impact. I truly do. And so thank you. I know we can stop this together. We can, being brave and standing up and really speaking out. I think that we can make an impact and get this thing to back down, hopefully before too many people further are injured or worse.
Yeah.
So
Good luck, Shelley.
Thank you
Yeah.
so much. It was a pleasure meeting you guys.
Yeah, I'm so sorry.
and I'll send that information to you about that doctor who's doing the
Sounds great.
immunotherapy.
Yeah,
And just reach out to his office, okay?
so thank you for everything.
Yeah, of course. All right. Have a wonderful day. We'll talk again.
All right. Talk soon.
Bye.
Bye,
Bye-bye.
Taylor.